In order to become one of the healthiest nations, we need the help of fantastic public health professionals working in the field and many different sorts of areas. One such area is looking at violence prevention, including the issue of mass incarceration, which is one of the issues that the American Public Health Association has outlined as a problem within the U.S.
I think of public health as having both an art element to it and a science element to it. And we work to not only promote health, but also prevent disease, disability, and injury. One of the ways we do that is encouraging healthy behaviors. So if we think about this from a violence perspective, public health is all about kind of making and creating communities and cultures that are intolerant to violence. So this can operate on both an individual level, but also a community and a population level. So how we as a community agree on the idea that violence is not a good idea, that violence can have negative health consequences for both the individuals that are directly impacted, but also for the families and the communities that they're a part of. So if we even look at the top 10 leading causes of death, violence plays a role in some of them. And I think that's a significant minority that we might not oftentimes be thinking about. So suicide and homicide are two of the top 10 leading causes of death in this country. And those are sensitive topics that a lot of times people don't want to talk about, but they oftentimes are associated with violent behaviors. So we as a population, we as a community, we as a nation need to think about the role that violence plays in our health outcomes. And it's not just about injuries or disability, but it's frankly about mortality.
In order to make change within our incarceration system, we need change not only at the local level of what people are being charged with, but also at the federal level and beyond. So we need to change our laws to make it so that folks are not being incarcerated for small crimes. We know that those who are incarcerated are unable to provide for their family, and we even know that if you know someone who's incarcerated, your health can be impacted. So even if we begin to change at the local level, we still need to change laws so that everyone has a chance to be healthy. And this usually starts with education, providing quality education, helping students make it through the K through 12 system so that they have an opportunity to go to college.